Temporary staffing post-COVID. Hi and welcome. This is Mark Struthers, and today we are going to look at the opportunities for temporary healthcare workers in the post-COVID era. Contract healthcare employees were once compensated at very high compensation rates and enticements to work during the COVID epidemic. Today's post-COVID work environment has changed the types of assignments available and the rates of compensation. The supply and demand for temporary staffing is not as great as during the peak of the epidemic. The career path still provides great opportunities for nurses and allied healthcare specialists, but these opportunities reflect changes in compensation based upon the current work environment. Independent contracting is common in a variety of healthcare roles, especially for professionals who value flexibility or are highly specialized. Here are some roles often seen when working as independent contractors. 1. Physicians and surgeons. Many doctors choose to work independently, particularly specialists and those providing locum tenens, temporary physician, services, NPs, and physician assistants, PAs. These advanced practice providers often offer their services independently to clinics, urgent care centers, or telemedicine platforms. 3. Registered nurses, RNs. Travel nurses and per diem nurses often work as independent contractors, filling staffing gaps in various healthcare facilities. 4. Therapists and counselors. Physical, occupational, and speech therapists, as well as mental health counselors, frequently contract directly with facilities or operate their own practices. 5. Radiologic and diagnostic technicians. Ultrasound technicians, MRI technologists, and other diagnostic professionals sometimes work as freelancers or on a per-job basis. 6. Pharmacists. Independent contracting is less common but possible, particularly for roles in consulting or specialized pharmacy services. 7. Medical coders and billers. These professionals often work remotely as contractors, providing coding and billing services for healthcare providers. 8. Home healthcare providers. Independent contracting is common for nurses, aides, and therapists offering in-home care. 9. Telehealth providers. Professionals providing virtual healthcare such as telehealth doctors, nurses, or therapists often operate as independent contractors. 10. Allied health professionals. This includes roles like respiratory therapists, dietitians, and athletic trainers who may work with specific facilities or teams on a contract basis. 11. Dentists and dental hygienists. Some dental professionals, especially those with specialized skills like orthodontics or endodontics, may work independently. 12. Healthcare consultants. These can include professionals advising on management, compliance, or operations within the healthcare system. Contracted temporary healthcare workers, often referred to as travelers, are basically self-employed and may work independently or with an agency. The worker is solely responsible for their failure or success in their career choices. The primary caveat is that the traveler is not employed by the facility. They are contracted with the facility and thus must be responsible for all aspects of their employment, including professional licensing and taxes, both state and federal. Demand for healthcare services. The increasing demand for healthcare services due to an aging population and the prevalence of chronic diseases drives the need for more healthcare workers. The complexity and specialization of healthcare services require a diverse range of professionals, including nurses, physicians, technicians, and support staff. Regulatory requirements. Healthcare facilities must comply with regulatory standards that mandate specific staffing levels to ensure patient safety and quality care. Technological advancements. The adoption of advanced medical technologies and electronic health records necessitates skilled professionals to operate and manage these systems. Economic factors. Economic conditions and funding for healthcare services can impact staffing levels and the availability of full-time positions. Work environment. The work environment, including the physical and emotional demands of healthcare roles, can influence the retention and recruitment of healthcare workers. These factors contribute to the high percentage of temporary workers in hospitals and medical facilities compared to other industries. The main factors influencing the percentage of healthcare workers in hospitals and medical facilities include the demand for healthcare services. The complexity and specialization of healthcare services require a diverse range of professionals, including nurses, physicians, technicians, and support staff. Regulatory requirements. Healthcare facilities must comply with regulatory standards that mandate specific staffing levels to ensure patient safety and quality care. Temporary staffing in the healthcare sector presents a unique set of challenges for contract employees, whether they are affiliated with an agency or engage in direct contracting with facilities. Temporary employees often receive higher financial compensation because they do not receive benefits, and some may also receive subsidies and housing allowances. This can lead to resentment and jealousy among full-time staff, who need to recognize that their job stability comes at a cost. Temporary contract employees in healthcare face several financial and emotional costs. Financially, they often receive higher compensation due to the lack of benefits, but they may also have to manage their own contracts, billing, and taxes, which can be time-consuming and complex. Emotionally, temporary employees may experience uncertainty and lack of control over work assignments, leading to periods of instability. They may also face challenges in adapting to various work cultures within medical facilities, which can be stressful. Agency-based contracting. Dependence on agency. Temporary staff are reliant on the agency for job placements, which can lead to periods of uncertainty and lack of control over work assignments. Reduced earnings. Agencies typically take a portion of earnings as a fee, potentially resulting in lower overall compensation compared to direct contracts. Lack of flexibility. Employees may have limited input on job locations, schedules, and assignments, which are often dictated by the agency's contracts with facilities. Independent contractors. 1. Flexibility and autonomy. Contractors have full control over their schedules and can choose which jobs to accept. They negotiate directly with healthcare facilities on pay rates, working conditions, and other terms. 2. Earnings and benefits. Earnings can be higher as there is no agency taking a cut of the pay. However, they are responsible for their own taxes, including self-employment tax, and must secure their own health insurance and retirement plans. 3. Liability and risk. Independent contractors assume more personal liability and typically need their own malpractice insurance. There is a risk of inconsistent work availability. 4. Administrative burden. They handle their own invoicing, taxes, and paperwork, which can be time-consuming. Managing contracts and ensuring compliance with local, state, and federal regulations falls entirely on them. 5. Professional independence. They may build direct relationships with healthcare facilities, potentially leading to recurring engagements. They have full responsibility for maintaining their professional licensure and certifications. Working through an agency. 1. Convenience and support. Agencies handle job placement, scheduling, and administrative tasks like billing and tax deductions. Workers often have access to a recruiter or support team to address concerns or issues. 2. Earnings and benefits. Pay rates are typically lower due to the agency's fees or commissions. However, many agencies offer benefits such as health insurance, retirement plans, and professional development opportunities. 3. Liability and risk. Agencies often provide malpractice insurance and take on the responsibility of compliance with regulations. Workers benefit from a steadier flow of assignments compared to independent contractors. 4. Flexibility. While there is still some flexibility, workers must abide by the agency's terms and conditions, which may limit their autonomy. Scheduling may be less flexible as agencies prioritize the needs of the healthcare facility. 5. Career. Agencies can provide access to a broader network of opportunities and roles in different healthcare facilities. They can also offer additional training or certifications to enhance the worker's skill set. Job security. Without the support of an agency, finding consistent work can be challenging, leading to potential gaps in employment and income instability. Contracting directly with facilities requires strong negotiation skills to ensure fair compensation, benefits, and working conditions. Contract employees must weigh the security and support offered by agencies against the potential for higher earnings and greater control through individual contracting. The work environment. Quick integration into a challenging, understaffed department can be difficult due to several factors. Firstly, the lack of adequate staffing means that new employees may face increased workloads and pressure to perform immediately. Additionally, the unique departmental dynamics require rapid adaptation to specific norms and practices. Adapting to the various work cultures within a medical facility is a multifaceted challenge that requires awareness, flexibility, and proactive engagement. By understanding the broader organizational culture, embracing departmental norms, and employing effective strategies for adaptation, new or temporary employees can seamlessly integrate into their new roles and contribute to the provision of outstanding medical services. The journey of adapting to the diverse cultures within medical environments is critical for new or temporary employees. Understanding the unique characteristics of each facility, including patient demographics and departmental norms, enhances integration and service delivery. Understanding organizational culture. Hospital culture is shaped by its mission, values, and staff behaviors, and recognizing these elements is crucial for successful integration. Impact of patient populations. The demographic makeup of patients influences the focus of care, with rural hospitals emphasizing primary care and urban facilities prioritizing specialized services. Departmental dynamics. Each hospital department has its own culture, influenced by the nature of work and team challenges, requiring employees to adapt quickly to specific norms. Strategies for effective adaptation. New employees should engage in research, observational learning, effective communication, flexibility, and seek support to navigate and integrate into the medical culture successfully. Temporary healthcare workers face various physical and work-related risks based on their work environment. To assess these risks prior to taking a contract, they can consider the following steps. Research the facility, investigate the reputation, safety records, and working conditions of the healthcare facility. This includes understanding the patient demographics, departmental norms, and overall organizational culture. 12. Evaluate job requirements. Carefully review the job description and requirements to understand the specific duties and potential hazards associated with the role. This includes assessing the workload, pressure to perform, and unique departmental dynamics. Consult with current or former employees, speak with individuals who have worked at the facility to gain insight into the work environment, safety protocols, and any challenges they faced. This can provide valuable first-hand information. Understand contract terms. Thoroughly review the contract terms, including compensation, benefits, and working conditions. Ensure that the contract addresses any concerns related to safety and work environment. Assess support systems. Determine the availability of support systems within the facility, such as mentorship programs, training, and resources for temporary staff. This can help mitigate risks and enhance integration. Healthcare facilities present several common hazards that can affect both temporary and permanent staff. These hazards include physical hazards. These include exposure to infectious diseases, needle stick injuries, and musculoskeletal disorders due to lifting and moving patients. Workplace violence. Healthcare workers may face violence from patients, visitors, or colleagues. 1. Training on conflict resolution and safety measures can help reduce the incidence of workplace violence. The average length of time that a healthcare worker works as a temporary employee before accepting full-time employment opportunities can vary widely based on several factors, including the individual's career goals, the demand for healthcare professionals, and the specific needs of the healthcare facility. However, it is common for temporary healthcare workers to transition to full-time roles within 6 months to 2 years. This period allows them to gain valuable experience, assess the work environment, and determine if the facility is a good fit for their long-term career goals. Thank you for your time and attention. Please take a moment to subscribe to my channel.